Talk a little health news to your health with Houston's only TV health reporter, Haley Hernandez. So what are we talking about this morning?
Yeah, so this morning we are focusing on the recent update from the Houston Health Department about a rise in syphilis cases among women in our area. So joining me this morning to talk about the rapid community outreach response, STI prevention specialist Marlene McNeese. Good morning, Ms. McNeese. Thank you for joining me.
Hi, good morning.
So y'all are saying there's a 128% increase. So tell us, what exactly is syphilis? Who would be most at risk for this?
Sure. Syphilis is a bacterial sexually transmitted infection that can cause serious health problems if left untreated or undiagnosed. And so there are basic stages of syphilis. We are really most concerned about primary and secondary stages of syphilis. These are the most infectious stages. And people may have symptoms, but they may attribute them to other causes and just ignore that syphilis may be the underlying problem. So we really hope that everyone sort of takes heed to this awareness about what we see in the rising cases and the rising rates and seek out appropriate treatment.
Because really people could ignore it because the symptoms are a little bit like regular cold and flu, and therefore you might not protect yourself and could continue passing it on to others. Is that right?
Correct. And so in the early phases, as I said, there are signs and symptoms that mirror or mimic other infections. And so people may see sores that may or may not be painless. So they may attribute a rash either in the genital area or in other parts of the body and just, attribute it to other things. And so we hope that if folks are indeed having unprotected encounters with partners who they don't know what their sexual health status is, to really seek primary medical treatment from their doctor and just discuss their risk and their options for testing.
But tell me, why the increase now? I mean, we've actually been reporting that syphilis has been on the rise since 2020, but what's happened that led to this increase?
Sure, and because it's an infection that is so easily treatable and curable, we were at very, very low levels for a number of years. And so what we are seeing is that despite, screening guidelines for pregnant women, where we are required by law to screen pregnant women in the first semester and the third semester, we still are seeing congenital cases where moms are passing along the infection to babies. So we believe there may be under screening, under-diagnosing in women of childbearing age. Mm-hmm. And we also believe that some of the attributing causes to this new increase is really, I think people have had a bit of, apathy to thinking that syphilis may not be a problem anymore. We don't talk about it a lot in the media. And so I think people have just been lulled into a sense of complacency that syphilis is not the problem that it is. And as I said, it's so easily treatable and curable. Yeah. We were at very, very low levels in Houston many years ago. And now we just want the public to be aware that these rates are really, really rising. And so we know that folks need to be screened, even if they suspect something is going on, or even if they don't suspect something may be going on.
Well,
just
one last
having
thing,
these
though,
conversations with your primary care provider.
But how are you going to mitigate the spread? I mean, how can people get help now?
Sure. First and foremost, if they do have a primary care provider and they are indeed sexually active, making sure they have a conversation about getting tested and screened for syphilis, because if they are positive, it's easily treatable and curable. For those that are without a primary care provider, we certainly in our Houston Health Department health centers are offering services to treat and diagnose syphilis. So we are waiving fees currently for individuals who are seeking out support in our clinics. We have 3 clinic locations throughout the Houston area. So folks can just get to a medical provider either through us or through their primary care doc and be able to get those questions answered and get the right tests so they can get the right treatment and cure.
Okay, Marlene McNeese, I appreciate your input this morning. All good points, and I appreciate you joining us live for our broadcast.
Of course, thank you.